Hello, hello. It's Big Cheds. This is My Battles with Cancer, a candid patient and caregiver's memoir. I want the entire book to be free. I want it to be available to anybody who wants it. I was a cancer patient and a caregiver, and I decided that I wanted to eventually make a book and a video series, and that's what we're doing. I published it back in 2020. And then I published two more books. I published Trading Quotes and Trading Wisdom. And then I went back and said, I want to rewrite this book. It's too important to me. So I spent most of 2023 rewriting the book, simplifying it. And then I recorded the audiobook. So you can actually get it on Audible right now. But I want everyone to be able to have access to it. So I'm reading it one chapter at a time on YouTube. So now we're up to, last time we got my diagnosis, and now we are up to what it's like to actually get chemotherapy. So let's jump right into it. And I'm going to read straight through. If I make a mistake, I'm going to keep going. These are one take. So folks, thank you for listening. Facing the unknown. Treatment. After processing all the wonderful well wishes and advice from friends, family, and those on Twitter, it was time to press forward and begin my battle with cancer. The first step was to have an EKG to make sure my heart was strong enough to handle chemotherapy. As a freshly diagnosed cancer patient and someone who was in relatively good shape, I was confident that my heart would be strong enough to handle the treatment. That being said, I was still a little bit nervous that they might find something unexpected. The last thing I wanted was to have another problem to deal with, in addition to my stage 3 cancer diagnosis. Able to avoid most of the day's traffic for my appointment, I arrived about 20 minutes early and I checked in with the nurse. Once my name was called, I was led down a long hallway and past a sign for the cardiology department, and then finally into a small room. The nurse walked out as the technician walked in, a short and squat man in his late 20s with thick, dark hair. He slowly and methodically connected roughly 20 electrical nodes to my torso that had these little tiny suction cups and warned me that they would probably rip out some chest hair when they were removed. The EKG procedure itself turned out to be no big deal. I just laid on one side of my body for about 45 minutes while the technician applied gel to my chest area and moved the sensor around my heart to gather data. Once he was finished, I got dressed and I went home and to get ready for my first chemotherapy session. That is, assuming there were no issues resulting from the EKG test. It was rather difficult to know how to properly prepare, either mentally or emotionally, for chemotherapy, as I really had no idea what to expect. And this is why I'm writing this book, folks. Even with all the research I had conducted online, I had absolutely no idea how my body would handle these medicines. I also had no idea in what ways my spirit would be tested or what life would be like at home while I recovered. There was literally no way for me to know for sure what I would feel like the next day or the next week. So all I could do was be open-minded and trust in my medical team and support system to help carry me through. As I understood it from speaking with the doctor, there was a 3-week cycle for each chemotherapy treatment, and I was set to have a total of 6 cycles. Once I received that chemotherapy medicine via an IV drip, my immune system would be highly compromised for the next 7 to 10 days. And then it would slowly build itself back up until I was healthy enough to receive another session of, quote unquote, therapy. My immune system was going to be highly impacted during treatment, and that would leave me vulnerable to disease, illness, and infection. With that fact in mind, my wife and I spent a lot of time cleaning up the house to make it sterile and ready before we started chemotherapy. We scrubbed every surface we could find, seeking out those pesky germs. We also brought face masks for people when they came to visit because you can never be too careful about the germs that folks bring inside your house. The face masks were for me as well, as I planned on using one when I had to leave the house. This was especially important if I was going to pick up my daughter from daycare. Before my cancer diagnosis, I had been taking my daughter to and from daycare each day, and that was about to change as I could not risk exposure to all those germs floating around from her classmates. I was also worried about my daughter bringing these germs home with her and getting me sick, so we had to change her clothes and to have her take a shower every day when she got home from school. I needed to be especially careful during the first 2 weeks of each chemotherapy cycle, and then I could relax just a little bit during that third week as my immune system had mostly recovered. It was a terrifying feeling to know that there were these invisible germs flying around that could make me sick or even kill me. That really did a number on my psyche. In addition to cleaning the house, we also rearranged all the furniture so I could be more comfortable while I was recovering. We made sure I had just the right side table in place. We moved the bed in front of the television and, of course, set up a large waste bin next to the bed so I could throw up when I was sick. It was critical to prepare the house as much as possible before we started chemotherapy, as I planned on being immobile for long periods of time. I wanted everything to be within my reach when I needed it. When you're diagnosed with a terrible disease, it's easy to feel like everything is out of your control. Setting up the house the way you want ahead of time is something you can control. It is critically important that you do whatever you can do to make that journey a little bit more manageable. With the house finally ready to go and the day upon us, it was time to head into the hospital to begin my chemotherapy regimen. There would be no more delaying. There would be no more denying the inevitability of subjecting my body and soul to chemotherapy. With these new medicines set to enter my body, I would undergo a paradigm shift from a healthy, normal person to a sick cancer patient. Even if I survived the treatment, my body would be damaged and I would be forever tainted. The medical oncologist told me that I would be in the hospital for 8 to 10 hours that day, so I decided to bring with me some of my favorite toys. The first thing I brought were my iPad, and then some headphones, and then a book that I was reading. In my mind, I would be laying there in a chair, wearing my pajamas and watching videos on my iPad, all the while just doing my best to stay distracted from watching those chemotherapy medicines running through the IV drip and into my body. For the most part, what I knew ahead of time about chemotherapy came from watching characters on TV or in movies who were going through cancer treatment. For example, Junior Soprano or Johnny Sack from HBO's The Sopranos, or Jack Nicholson in The Bucket List. These characters seemed to suffer severe pain and discomfort as a result of their chemotherapy. They were constantly throwing up from nausea, losing body weight, and their hair as well. Thinking about going through something like that frightened me to no end. I did not want to waste away while glued to a toilet. The fact that I really did not know how strong I would ultimately prove to be scared me more than anything. All I knew was that I would be sitting there hooked up to that IV machine with drugs being pumped into my system, and afterwards I would be in severe pain and likely suffer from extreme nausea. However, regardless of my fear and trepidation, it was time to experience this quote-unquote treatment firsthand. We parked at the hospital and used the convenience of the valet option as we had for our prior visits. After checking in at the front desk and grabbing a new plastic bracelet, we went over to have my blood drawn. Upon approaching the waiting area that day, it was incredibly busy. In fact, it was so busy that my wife and I were unable to find two seats next to each other, and we had to sit in different areas. On such an important day, that felt strange to me. Imagine going to a movie with a date and it's so full that you have to sit in different rows. It's so busy you have to sit in different rows. And this was basically how it was for us. Understandably, I was feeling a little bit vulnerable that day as I was about to have chemotherapy for the first time. Sitting by myself just exacerbated those feelings. Luckily, my name was called rather quickly, and after they drew my blood, it was time to head upstairs to see the oncologist one more time before starting that treatment regimen. One of the first things I asked the doctor was about the blood test, and as I was hoping that my results would be ready for him to analyze. The doctor had explained during our last visit that it was critical to test my blood every time I came so we could see how my body was holding up over time. Two of the main tests were a CBC, or complete blood count, and a comprehensive metabolic panel. According to the Mayo Clinic, a complete blood count is a blood test used to evaluate your overall health and to detect a wide range of disorders, including anemia, infection, and leukemia. A complete blood count test measures several components and features of your blood, including red blood cells, which carry oxygen, white blood cells, which fight infection, hemoglobin, the oxygen-carrying protein found in red blood cells, and hematocrit, or the proportion of red blood cells to the fluid component, or plasma, in your blood, and platelets, which help with blood clotting. According to Wikipedia, the comprehensive metabolic panel, or chemical screen, is a panel of 14 blood tests which serves as an initial broad medical screening tool. The CMP, or Comprehensive Metabolic Panel, provides a rough check of kidney function, liver function, diabetic and parathyroid status, and electrolyte and fluid balance. From our prior meeting with the doctor, we knew that on the weeks that I was going to be receiving chemotherapy, I would have 3 appointments. First one was the blood test, then a meeting with the doctor or registered nurse to review my progress, and then the last test to receive the actual chemotherapy medicine. 1 week later, I would come back to have my blood tested again and would meet with the doctor or registered nurse to see how I was doing. Finally, I would return 2 weeks after that, and my blood would be tested again to see if I had recovered enough to receive a new dose of chemotherapy. This was the treatment cycle. The doctor emphasized that it would be ideal for me to properly rest and recover in that 3-week window so that I would have the best chance possible to defeat my cancer. He explained that any delays would give the cancer time to recover from the chemotherapy. The doctor revealed that my blood tests were good and said that otherwise I was quite healthy for my age. My wife and I asked a few more questions, and then it was time to move on and begin the treatment. Next, we were directed over to a new waiting area that had a sign that read Infusion Area. According to the NIH, or National Institutes of Health, intravenous infusion is a method of putting fluids, including drugs, into the bloodstream, also called infusion. After a brief wait, a vibrant young nurse with blue eyes led me through a set of doors and down a hallway towards a side patient room. Along the way, I noticed other patients who appeared to be receiving chemotherapy that day. Most of them had at least one other person besides them to keep them company during the treatment. In each of these small side rooms I passed, there was space for up to 4 patients, each with their own little area separated by a curtain. In my mind, I had imagined that I would have my own private room. with all the doctors and nurses focused on me and making sure I was comfortable. Of course, reality was a little different, given that I didn't even have my own private room. Like it or not, I had to accept the fact that there were other people in the world who had cancer, and they too needed the help of these medical professionals. Given that I was just one tiny piece of this puzzle, I had to get used to the fact that I would not have anywhere near the privacy or exclusive attention of the medical staff that I had hoped for. That realization further reinforced in my mind the idea that this hospital was something like an efficient machine, perhaps akin to a factory. I was on the conveyor belt as an unfinished product and just one of many. When we finally reached the room that I'd been assigned, I was directed to sit down in a chair. This chair was somewhat like a recliner, but nowhere near as soft or comfortable to sit in. Doing my best to settle in for the long haul, I played with the settings on the chair by raising it and lowering the footrest, and then I adjusted the back support until it felt just right. Then I reached into my backpack and pulled out my pajamas, prompting a funny look from my wife. I explained to her that if I was going to be having all those chemicals pumped into my body, I planned on being as comfortable as possible. If that meant wearing pajamas and slippers, I was going to do that as an attempt to replicate the experience of watching TV from my recliner. Soon thereafter, we were greeted by a nurse in her early 40s who explained that she would be in charge of my care during that day's chemotherapy session. She was short in stature, but carried with her an air of confidence. The nurse proudly displayed her name badge and credentials as she asked to see my name badge, or in this case, plastic ID bracelet. After finding out that she grew up in a town nearby me, that information, along with her earthly vibe, helped me to feel a little bit more comfortable. And, for that reason, I felt like she might understand me pretty well. Once we finished with the small talk and other formalities, she sat down right next to me and she went over the chemotherapy drug cocktail I was about to be given. R-CHOP. R, rituximab, and a bunch of side effects. C, cyclophosphamide, and there's a bunch of side effects. You can see it all on the screen. H, doxorubicin, bunch of side effects. This one's nicknamed the Red Devil, H, doxorubicin. O, vincristine, and again, bunch of side effects. And P, prednisone, also, again, a whole bunch of side effects. The prednisone was given to me in a pill format, and I was going to take 2 during that chemotherapy session at the hospital and then take another 2 in the morning at home each of the next 4 days. As a bit of a spoiler, prednisone has absolutely the worst taste in the world. Throughout my treatment, I found that really the only way to take it and not gag was with yogurt. No matter what, I made sure to get it down on the first try. Otherwise, there were unpleasant consequences. One time, I made the mistake of trying to take 2 pills at once. I failed to swallow them, and they started to dissolve in my mouth, leaving the most rancid aftertaste for hours. And I can close my eyes right now, actually, and still remember it. Now that the nurse had explained the side effects of the treatment regimen, it was time to begin with the first drug, rituximab. This particular medicine was vital to my chance of beating cancer, as it has increased lymphoma survival rates greatly over the last 20 years. According to bloodjournal.org, rituximab was approved by the U.S. Food and Drug Administration for use in DLBCL, it's the cancer I had, nearly 20 years ago. It was the first immunotherapy approved for specific use in cancer, and it quickly demonstrated a dramatic improvement in outcomes in patients with DLBCL when combined with other chemotherapeutic agents. Rituximab has since been approved for use in chronic lymphocyte leukemia, follicular lymphoma, and rheumatoid arthritis. It specifically targets CD20, which is expressed on normal B lymphocytes and on several types of malignant B cells. The nurse explained that my first session was going to be 2 hours longer than normal, as they had to make sure my body could handle that full dose of rituximab. The plan was to start out with a low dose and then increase that dose every 30 minutes as they watched to see how I responded. With the instructions delivered to me, it was time to begin. And I watched as that medicine made its way from the IV bag and into my veins. Physically, I didn't feel anything other than a mild discomfort, and that gave me a sense of relief. However, emotionally, it was difficult to watch that poison enter my body. There was no turning back now. While this was going on, I tried my best to stay in the moment. My goal was to cultivate a peaceful and positive mind state through breathing and listening to music. Each time another 30 minutes elapsed, the nurse upped the dose of rituximab until I reached the full amount. The good news was that I seemed to be responding well. To help pass the time, I made great use of my iPad and I watched one of my favorite shows, Judge Judy. Watching her dispense justice was a great escape from reality, if only for a little while. My wife sat there just listening to her music as the first drug worked its way through my system, and she checked in with me from time to see if I needed anything. It was wonderful to have her with me as support. It really was. Without her, I don't know. Without her, I know I would have been absolutely miserable. In retrospect, we probably over-prepared a little bit for the first chemotherapy session, as we had brought books, blankets, games, and more, almost as if we were going for a weekend getaway or camping trip. Regardless, we had decided that it was better to be over-prepared than under-prepared. However, for future sessions, we plan to pack a little bit lighter. Once the rituximab was administered, it was time to move on to the next drug, or vincristine. I was able to take the full dose of this medicine right away. At this point, I was a little bit bored of watching Judge Judy, so I switched back to listening to music. For this day, I had all my favorites with me: Vivaldi, Bach, Handel, Telemann, and more. I should say Mozart in there too. And I started with some oboe concertos. Classical music has always been a source of inspiration and an escape for me. And this was a moment when I surely needed some of both, inspiration and an escape. As the clock ticked away, I watched as the medicine continued to drip into my veins. It was almost like an out-of-body experience. The feeling was surreal. And to stay grounded, I kept reminding myself that this scary medicine was going to seek out and kill the cancer cells that were hiding in my blood. More or less, it was somewhat comforting to remind myself that I was going through this arduous process because I was a broken man. And this medicine represented my best chance to get fixed. The nutritionist came by and introduced herself a little while after the second drug was administered. And she was in her late 30s with dark brown eyes and skin that had a subtle glow to it, presumably reflecting the purity of her diet. Her overall appearance reminded me of a friend I had in college, one who was always lecturing me about my diet and encouraging me to switch to organic foods. I found that amusing. My wife and I had requested this appointment so we could find out which foods were okay to eat and which ones we should avoid, and in general, so we could better prepare for the coming weeks and months of recovery at home. It was really nice to have some of our rather specific culinary questions answered, and when it was over, we thanked her for her time before she moved on to whoever the next broken patient was. After 30 minutes or so had elapsed, I was finished with the vincristine, and with great pleasure, I watched the nurse take that empty bag of medicine away from the IV machine. I was already starting to count down in fractions or percentages how much chemotherapy I had left to endure. I would say to myself, okay, I'm now 2/5 done with this session, and with 6 sessions to go, I guessed that I was maybe 5 or 6% done. As a metaphor, imagine that you are stuck in prison and you can do nothing but stare at the wall for the next 40 days. On this wall, you might make 40 strike marks with a piece of chalk, and each morning you wake up and cross off one of those marks. That was my mentality, taking note of every little morsel of progress along the way towards my ultimate goal of successfully completing the chemotherapy regimen. As I slowly worked my way through the remaining chemotherapy drugs, my wife just sat there showing little emotion as she sat patiently and read. There was a quiet strength to her, and her calm demeanor helped me to stay in the moment, as it was just so easy to get wrapped up in worrying about what the future might look like. While we conversed, my wife and I, among other things, we talked about a school play that our daughter was set to perform in. It was really nice to have things to talk about other than chemotherapy, as we continued to make life plans as if everything was going to work out just fine. My wife stayed with me almost the entire time, except for when she went to the cafeteria or took a phone call from work. I really had no idea how my stomach would react to food while I was receiving chemotherapy, but nonetheless, I was quite hungry, so I asked her to bring me back a slice of pizza. Pizza has always been one of my favorite foods, and this was a great opportunity to lift my spirits a little bit with a nice warm slice. When she returned with my prize, I reminded myself that soon I would have no appetite, and I slowly savored every bite of that pizza before returning to my music, a happy man. A little while later, the nurse came back and sat down next to me, and this time she was wearing a plastic gown and rubber gloves. In her hands, she held 2 huge red vials of the next drug, H, or doxorubicin. This is the red devil. When I asked this nurse why she had to wear all that protective gear, she explained that it was a precaution since that specific drug was powerful and potentially even dangerous. If you spill even a little bit of this medicine, it can burn your skin or damage your nerves if it somehow escapes your veins. The nurse explained that she had to push, quote unquote, push this medicine into my veins with a large syringe, rather than administering it through an IV drip like the prior ones. According to Wise Geek, the intravenous or IV push or bolus is a method of delivering additional medication through an intravenous line, administered all at once over the period of a minute or two. This contrasts with IV drip techniques where medicine is slowly delivered from an IV bag. An IV push has the advantage of being able to give extra medicine as needed without having to inject the patient elsewhere. And that method can rapidly get this medicine into the body since it is injected directly into the bloodstream. To add a little bit of context about this chemotherapy drug, while I was receiving the H or doxorubicin medication, I tweeted out a photo to my audience on Twitter, and some people shared with me their own experience with this medicine. That moment in particular always invokes strong memories for me, and you will see that it did for those who responded to me as well. Here are some of the responses from my followers. Quote, "Screw that. Seeing the red syringe reminded me of my therapy a few years back. Wishing you the best. You'll beat that like I did. Crypto Dawn Alt." Thanks, man. Quote, "This picture, man, my dad all day long. I still remember the feelings from the parking lot before, hallways in the room during, and the car rides home." James BTC. Thanks, bud. Quote, "Is that the red devil, doxorubicin, that they have to put a hazmat suit on just to administer? I'm doing the same chemo if it is. Stage 3 triple negative breast cancer here. I feel your pain and discomfort. This is one of the most horrible feelings, but we can get through it. Victoria. Thank you, Victoria, and I really do hope you are well. Appreciate you sharing that. These responses really hit home, especially that last individual who talked about the nurse having to wear a hazmat suit. The Red Devil nickname for this drug stood out to me as well. It did make me feel better, though, to know that there were people who had gone through some of the same things I was dealing with, and I really appreciated them sharing their experience with me. My sister stopped by to see how I was handling the chemotherapy a little while later, and it was quite a moment as she walked in. I was struck by the juxtaposition of her standing there as a strong and accomplished doctor while I was laying back in the chair as a weak and fragile cancer patient, a broken man. Seeing patients in my condition was a normal part of her routine, but for me, it was anything but routine. I was a broken man who was desperate to be cured and in extremely tough shape emotionally. All that aside, it was really nice to see her and to know that she had my back as best as she could. During our brief conversation, we talked about normal stuff, and then she returned to her work and I to my classical music. After the nurse finished with the Red Devil, it was time to move on to the final drug, C, or cyclophosphamide. When I realized that I had only 1 hour left in my first chemotherapy session, that was a big emotional boost for me. So far, my experience had not been nearly as bad as I had originally feared, though I knew that none of the side effects had started yet. As a precaution, I told myself that it would be important not to declare victory until I knew how my body would respond to these powerful medicines. It was around this time that we received a visit from the social worker. She was in her mid-30s with straight brown hair tied into a ponytail and had friendly blue eyes. Her casual vibe was disarming and likely intentional to help her deal with patients who were going through a tough time. After asking us about how we were feeling, my wife and I told her about what it had been like to prepare for and now ultimately receive chemotherapy. We talked about our difficulties explaining to our daughter that Daddy was sick, and we told her how we worried about how she might adjust to this new reality. The social worker was a great listener, and she offered us some advice centered around the concept of Daddy being sick versus Daddy having cancer. Her concern was that if our daughter associated the word sick with everything happening to me now, it might be confusing for her later when I got sick with something as simple as a cold. Instead, she suggested that we emphasize to our daughter that Daddy had cancer. And that way she would understand that my suffering was not associated with a regular illness. After processing the idea, we thanked her for her insight and for spending time with us. And that was actually quite thoughtful, what she said. Once she was gone, I returned to my music and playing games on my iPad. I think I was playing Hearthstone at the time. Soon enough, the last hour was over, and it was time to go home. As we wrapped things up, the nurse went over precise instructions on what to do in the coming days back at home. Again, I was told to take 2 of the P or prednisone pills with food every morning for the next 4 days, and then I was given 2 new prescriptions to go pick up at the pharmacy. Both of these prescriptions were designed to fight the nausea brought on by the chemotherapy drugs. However, these standard post-chemotherapy drugs had their own set of side effects. The nurse warned me that one of the side effects was severe constipation, and if that became unbearable, I should go buy some stool softener. Pardon me. In response, I rather emphatically explained to her that I planned on using CBD and THC, and I was confident that I would be just fine. Quote, between the chemo, THC, CBD, and wheatgrass, I've got it covered. Eastern and Western medicine. December 4th, 2018 at Big Cheds. It was a liberating feeling to put my street clothes back on and to pack up my stuff to leave. I had survived the first session of chemotherapy and could now head home and face the next step in my journey. As a confidence booster, I told myself that I was officially 1/6 done with chemotherapy. But in truth, I was cheating a little bit since I still had a full cycle of side effects to deal with. Excuse me, sorry about that. Taking my first steps away from the treatment area, I had my wife with me to lend me her strength. I was feeling weak, disoriented, and bloated from all the fluids they had pumped inside me. Even though I could mostly get around on my own, I was moving ever so slowly, and it felt like something was out of place. Running through me was a strange sensation where my body was no longer my own. It was almost as if I had been invaded by an alien or some strange entity. Driving home, every bump in the road or turn of the car felt as if my entire being was getting tossed around. My body was out of sorts, and it felt as if I had ingested something foul, and that wretched substance was slowly working its way through me. To keep my mind off this discomfort, I tried to think about how great it would feel to open the front door to my house and to just collapse onto my bed. Calming my restless mind were thoughts of watching TV and playing video games. As I imagined that bed waiting for me at home, I happily remembered that I had prepared all the pillows just right so I could lay back and melt into them. Having set up my recovery room ahead of time made that car ride home easier, much easier, and that was a huge emotional boost when I needed it the most. I also greatly looked forward to using the THC tincture I had waiting for me on the bedside table, and I planned to take it with some Powerade Zero to go down easier. Thankfully, I remembered that I also had a CBD chocolate bar and CBD Tootsie Roll ready to go as well. These were my silver bullets to fight the nausea and discomfort that I was already in the early stages of experiencing. It was psychologically critical to know that I had those special medicines, making it easier for me to hold on during that turbulent car ride home. Once we made it home, my wife helped me inside, and I collapsed onto the bed with an impressive flourish. It felt beyond amazing to be back at my home base, to be back somewhere that I felt safe and could recover. Just by laying in bed for a few minutes, some of that nausea started to drift away, and I began to feel as though maybe I was going to be all right after all. At that moment, it struck me that I had survived one trip to have all those chemicals pumped inside my veins. And here I was, back at home and still breathing. After taking a deep, calming breath, I grabbed my CBD chocolate bar and I ate it eagerly. And then I took some THC tincture drops to feel even more comfortable. And then I closed my eyes and tried to sleep, hoping that I could just pass out and wake up feeling refreshed. After endless tossing and turning, I realized there was little chance I would be able to drift off. I had simply been through too much that day. This was the beginning of an important 3-day cycle I would have to endure after every chemotherapy treatment. The next chapter is the first cycle. It's going to talk about what it's like to recover from chemotherapy and to deal with the nausea and how that feels. And I look forward to talking about that. This is My Battles with Cancer, a candid patient and caregiver's memoir. I want this book to be available to everyone. So I'm recording it for free on YouTube. You're here at YouTube Cheds Trading. The book is available on Kindle, audiobook, and paperback format. My other books are also available the same. Trading Wisdom has done incredibly well. And many thanks to you folks. I appreciate that. Also, Trading Quotes, wonderful book. Super proud of that. I'm, of course, Big Cheds on Twitter. That's where most of you probably know me from. This is My Battles with Cancer. This is the free version. I'm doing the whole book for free, and I'm super proud of that. And I hope you enjoy it. And thank you for listening, folks. I will talk to you soon.